sharp decline in the number of surgeries performed as COVID swamped the system.
A backlog of patients still in hospital who could be treated and cared for elsewhere.
The states and territories are scared their hospitals won't cope, calling on the federal government to pay half of public hospital costs for the next few years.
Hearing states complain about hospital funding is hardly new, and the COVID pandemic has put the public health system under unprecedented pressure. But the states argue it is not just COVID that is the problem. Ahead of a meeting tomorrow with Federal Health Minister Greg Hunt and Disabilities Minister Linda Reynolds, the states and territories have collected data which show the extent to which people with disabilities are occupying public hospital beds. The data shows that all states and territories have long-stay patients who have no medical reason for being in hospital, but who are staying there for months or even years, and they are blaming shortcomings in the National Disability Insurance Scheme. For example, in Queensland, there were 238 long-stay patients at the end of August, with NDIS-related delays in access and planning the most reported reason they could not leave. In Victoria, by the end of June, there were 247 patients who were NDIS participants, with NDIS delays again the main reason. While in New South Wales, in early September, there were 203 NDIS participants more than 10 days past their estimated date of discharge, but the state believes the real number could be much higher. Some of the case studies raised by the states are quite shocking. For example, the case of a 25-year-old man with an extensive history of mental health admissions who was in hospital for 3 years, despite being medically fit to return to the community, due to insufficient funding in his NDIS plan to meet his therapy and behavioural needs. In another case cited, an 18-year-old in Queensland was admitted to hospital in December last year following a breakdown in his accommodation and support arrangements. He did not require medical treatment. 7 months later, he was discharged. His hospital stay cost the Queensland health system $2 million.
This is the number one priority.
Queensland Health Minister Yvette Darth is the chair of the State Health Ministers' Council.
What we do know is that there are around 1,000 patients in hospitals around Australia right now who are medically well but need a disability package under the NDIS. Now, that equates to over $500 million and over 264,000 bed days. Like, this is extraordinary. And the number that we have in the health system right now is equal to building a new major hospital in Queensland. That is not good enough.
We know that younger people decondition very quickly when they're in hospital for extended periods of time, and that makes it even harder for them to move back to the community and take up their lives with some independence.
Bronwyn Markham represents younger Australians living in aged care and says a lack of suitable care for people with disabilities means many are discharged from hospital only to find themselves in nursing homes.
This is a real concern to us because the federal government also has a younger people in residential aged care strategy underway, and one of the first targets to come online next year is one in which there will be no younger person going into residential aged care from next year.
I have a friend who's in hospital 9 minutes from here who has been there for 18 months because the type of care that that person needs isn't actually provided in the type of care facility that he needs. And so, this is a very, very long-standing issue, but it's become really blown out of proportion during the pandemic.
Victorian Health Minister Martin Foley says the problem has been getting worse.
Public hospital beds are being used to poorly accommodate people with disabilities. These are complex issues. Yes, money is at the heart of it, but so is making sure that the National Disability Insurance Scheme achieves its goals. The administrative delays, the lack of training, the lack of housing.
There are lots of complex reasons why people aren't being discharged from hospital. Sometimes a lack of appropriate housing, care or rehabilitation services. Sometimes alternative care is available, but the bureaucracy is getting in the way.
The service providers have said to us that there are places for these patients to go to, but the funding models that sit behind those particular cases are simply not adequate.
You need to have enough market, providers to actually come in and pick up that load.
The question is what to do about it. What is happening in the hospitals is but a reflection of broader problems in the NDIS. Lack of funding, lack of training and assessment processes which are not delivering the levels of care needed by participants.
So what it is that the health ministers will be asking for from the Commonwealth is what they need to put in place measures that quickly discharge people into the NDIA.
The state ministers, both Liberal and Labor, will be proposing solutions at tomorrow's meeting to try to ensure the National Disability Insurance Agency is involved in cases that end up in the hospital system a lot earlier.
The state-run hospitals are always the service provider of last resort, and we're just saying now is not the time to play that game. We need the Commonwealth to step up so that we can manage the peaks of the demand that we're currently experiencing.
But it will ultimately require an acknowledgement by the federal government that there is a problem and it needs to be fixed, and may require changes to state government policies in areas like social housing. 7:30 invited both Ministers Hunt and Reynolds to be interviewed, but they were unavailable. In a statement, Minister Reynolds said the Health Minister's meeting paper was only circulated today, and the Commonwealth will give this proper consideration before formally responding. She said the policy solutions were complex and went well beyond the NDIS itself to issues like social housing. Any attempt to portray the NDIS as the major cause of strain on state and territory hospital systems was not supported by the evidence, she said.
To be honest, we people with disability don't care who pays for it as long as it's paid for. We want them to sit down like grown-ups and sort it out and make sure that people aren't in crisis.
Hi, I'm Lee Sales. Thanks for watching this story. If you'd like to watch more of 7:30's stories, they are on the left of your screen. And tap on the button below to subscribe and get the latest from ABC News.